All right, restoring perfusion, which is oxygen and glucose delivery, will restore the production of larger amounts of energy required, reverse the lactic acid buildup, and reestablish the function of the sodium-potassium pump. And to be effective, restoration of perfusion must be accompanied or accomplished before critical mass of cell death occurs. If the oxygen content in the ambient air that is being inhaled is diminished, the amount of oxygen in the alveoli available for gas exchange will also decrease. By increasing the oxygen concentration of inhaled air through oxygen therapy, more oxygen will be made available in the alveoli for gas exchange. If there is a disturbance in the ability of the oxygen to diffuse into the capillary, the blood oxygen concentration would be diminished as well. Most oxygen must bind with hemoglobin in the red blood cells. If an adequate number of red blood cells are present, or if they contain insufficient hemoglobin, or the iron, the oxygen carrying capacity of the blood is decreased. This results in a decrease in the delivery of oxygen to the cells. If a condition exists that causes the oxygen to remain bound to the hemoglobin, the blood will appear well oxygenated, but the cells will become severely hypoxic. All right, most emergency care of a patient in shock is geared towards maintaining or restoring oxygen and glucose delivery. Okay. So there's 3 reasons we have shock. All right. You have inadequate volume, which is not enough blood. Okay. Or not enough fluids, stuff like that. Okay. It's not just blood, but it's fluid as well. You have inadequate pump function. Remember, your heart's a pump. Right? So your heart's not working like it should. Then you have inadequate vessel tone. Okay? You can have injuries to where the receptors in your brain are not sending signals to your blood vessels to where they need to dilate or constrict. Everybody make a shift for today?
Yes.
Thank you. All right, inadequate volume. A patient who has a decreased blood volume will have a decrease in preload, which causes the stroke volume and cardiac output to fall. All right, you don't have that volume inside your body. So guess what's going to happen? You're not going to have enough blood going to your heart. You don't have enough blood going to the heart, you're not going to have enough blood coming out of the heart. All right, it's a very vicious cycle. A decrease in cardiac output causes a drop in the systolic blood pressure. The systolic blood pressure is responsible for transporting the oxygenated blood throughout the systemic circulation. A decrease in blood volume can result from loss of whole blood or from loss of plasma volume alone. Bleeding caused by whole blood loss, all right, whereas diarrhea, burns, excessive urination, increased capillary leakage, and excessive vomiting or sweating are all examples that cause loss of plasma. Okay, so this is not just I'm bleeding out somewhere. These are other things that can happen as well that can lead to shock. All right, that always needs to be in the back of our mind. The patient who is in shock from hemorrhage, all right, resulting in inadequate volume, obviously needs an increase in blood volume. A patient who is in shock from fluid depletion loses only large amounts of water and some electrolytes. This patient does not need whole blood, but does need to have fluid or water portion of their blood restored. All right. In this field, if you are working on a regular ambulance, we do not carry blood products. Okay. We can transport blood products, but we do not carry them. They must be refrigerated. However, what we can do to kind of supplement this a little bit. Yeah, me too. That's kind of why I was like. Anywho, what we can do to do this is replace some of that fluid with like lactated ringers or normal saline. Okay. Do you think if I give somebody that lactated ringers or that normal saline that it's going to help their oxygenation? It's not, okay? This is just a stopgap to be able to get us somewhere to where we can replace that blood, okay?
Basically a placeholder.
Yeah. Inadequate pump function. The heart is the pump responsible for generating the force necessary to move the blood through the body. If the pump fails, regardless of the blood volume, the delivery of oxygen and glucose to the cells will decrease. The heart is the pump responsible for generating the force necessary to move the blood through the body. All right, if the pump fails, regardless of the volume of blood, or the plasma, or the hemoglobin, or the oxygen, nothing's going anywhere, right? Okay. Pump function failure can result from an injury to the heart that reduces its ability to generate contractions strong enough to push the blood forward through the body. Heart attacks or acute myocardial infarctions deadens a portion of the heart muscle. Like any other muscle, a portion that is dead does not contribute to the force of contraction. If the heart attack has affected a large enough area of heart muscle, the pump will fail and lead to a shock state. Also, the heart can be weakened over time from disease, old age, or injury, and fail to adequately pump the blood as seen in congestive heart failure patients. Heart valve disease, cardiac rhythm disturbances can also reduce the ability of the heart to eject the blood effectively, also leading to pump failure. A mechanical obstruction of the movement of blood into the heart can also contribute to pump failure. The heart chambers can be compressed from a collection of blood in the pericardial sac. All right, this is what is known as pericardial tamponade. All right. If the chambers are compressed, the ventricular filling space is decreased, leading to a decrease in preload. That space is not big enough. All right, that fluid around the outside of the heart is keeping that bag compressed. All right. You can't get all the blood that you're supposed to get in that compressed bag. All right? Therefore, you're not going to get as much out. Another condition that leads to a decrease in preload from the compression and poor filling is a tension pneumothorax. Okay? When the chest cavity starts filling up with air, air can also compress the heart. All right? All right, with pump failure, administering fluids might temporarily help in some conditions, such as pericardial tamponade and tension pneumothorax, by increasing the preload. All right, we're going to increase the amount that's coming into the heart. But it can worsen shock and other causes, such as congestive heart failure. Okay? So you need to be able to differentiate between the two. All right? The patient requires improvement of the pump function to eliminate the shock state. All right, vessel tone. The tone is related to the size of the vessel and the resistance created within it, and is referred to as the systemic vascular resistance or peripheral vascular resistance. All right. A lot of these older people, they will have peripheral vascular disease. All right. They do not have this tone in their blood vessels anymore, okay? If the vessel size increases because of massive vasodilation, the resistance decreases. And the blood pressure and perfusion also decrease. It's got to have something to pump against, all right? It's a very delicate balance. All right, in this case, the patient has not lost any blood volume. However, there is no longer enough intravascular blood volume to fill the vascular space because the vessel size has increased so much. Okay, does everybody understand that? You got to fill the vessels up. All right, the result is a decrease in vascular resistance with a decrease in blood pressure and perfusion. The pumping function of the heart is normal, but the relative reduction in blood volume returning to the left ventricle reduces preload and thus cardiac output, leading to a decrease in blood pressure and tissue perfusion. To have an adequate blood pressure, the tone of the vessel must be maintained. The tone is related to the size and the resistance created within the vessel, okay? Kind of like you go to the gym, you get toned up. You go to the gym, I wouldn't know anything about that. I have a membership just for the tanning beds.
I use it, but I just use it for like those massage beds.
Mm-hmm. All right. The sympathetic nervous system provides tone by keeping the vessel size regulated to a certain size to maintain resistance and pressure. Therefore, inadequate vessel tone may occur if the sympathetic nervous system stimulation of the vessel is lost because of an injury to the spinal cord. All right. Another cause of inadequate vessel tone may be chemical mediators released in the body that cause a systemic dilation of vessels. The only way to increase the blood pressure and perfusion is either to decrease the size of the vessel through vasoconstriction to restore resistance or to fill the vessel with more volume. Typically, both approaches, vasoconstriction and volume restoration, are used in emergency care for cases with both blood pressure and perfusion are poor. All right, it's not only the cause of shock, but also the needed emergency care that may vary depending on the etiology, where the shock is coming from, okay? Is it inadequate volume, inadequate pump function, inadequate vessel tone, or guess what? It can be a combination of all three, all right? A treatment that is effective for low blood pressure and poor perfusion based on one etiology of shock may worsen the condition from another one. All right, it is vital to recognize someone who is in a shock state. That's a mouthful. And they're not even big words. And provide the appropriate emergency care and initiate rapid transport, okay? In some cases, most cases, it may be highly desirable to contact an advanced life support unit that has medications, IV fluids, and higher level of procedures that can restore the pressure and perfusion, okay? However, keep in mind that there's only so much an ALS unit can do, all right? So delay in transport is not one of the options there. All right, who knows the 4 major categories of shock?
It's way too tiny to read.
You ought to see it on my computer screen. Yeah.
Um,
Hypovolemic, obstructive, distributive, metabolic, respiratory, and cardiogenic. All right, there's 5 up there, but there's usually only 4 that we talk about, okay? All right, hypovolemic, distributive, cardiogenic, and obstructive, all right? These are actually broken down into more specific categories, okay? Should be a chart in your book. Tell you what that is. All right, so hypo means what? Low or inadequate. Vol, V-O-L, means what? Volume, and emic pertains to blood. Fantastic. Thus the term hypovolemic means what? Low blood volume, okay? Hypovolemic shock is the most common form of shock, okay? Any condition or injury that results in a reduction in the fluid portion of the blood, with or without the loss of elements formed elements, decreases the blood content or the fluid portion of the blood. The most common cause of hypovolemic shock is hemorrhage. All right, that's pretty self-explanatory, right? And then the non-hemorrhage forms associated with fluid loss, severe diarrhea, vomiting, excessive amounts of vomiting, peeing too much, sweating, stuff like that, okay? So it's not just always they're bleeding out. All right? The most common causes of hypovolemic shock is hemorrhage. Non-hemorrhagic forms are associated with fluid loss from burns and dehydration. There's usually no actual loss of fluid or blood from the vessels, but rather a relative reduction in the volume. That is a volume that has become inadequate to fill the increased size and capacity of the vessels. Fluid leakage from the capillaries and vasodilation cause a reduction in the preload, which reduces the stroke volume, cardiac output, and systolic blood pressure. The result is a decrease in tissue perfusion. If you don't have enough going in, you're not going to get enough coming out. Does that make sense? All right, cardiogenic shock. The patient has an adequate blood volume and vessel tone. However, hypoperfusion results from the inability of the heart to contract effectively. All right, so this is not a volume problem. This is not a vessel problem. This is a pump problem. All right, cardiogenic is the pump. Where does it come from? Typically, when more than 40% of the left ventricle has been lost cumulatively because of damage from a heart attack, congestive heart failure, infection, or abnormal heart rhythms, the patient is prone to cardiogenic shock. All right? So anything going on with the heart that affects its pumping ability, all right, obstructive shock. The volume is adequate, the heart's not damaged, and the vessels are of normal size with adequate resistance. All right, but you have a large clot that obstructs blood flow in the lungs. This is known as a what? Pulmonary embolus. Okay. It prevents an adequate amount of blood from getting to the right atrium and subsequently all the way to the left ventricle. Okay? So we have an obstruction in that circuit somewhere. Okay? Any of y'all do electrical work? If you unplug one of those wires, you're not going to have a complete circuit. All right? This can happen with a pulmonary embolus. Can happen with a tension pneumothorax. Okay? The air inside the chest cavity is pushing that heart over. It's obstructing something. All right, so how do we treat this? How do we treat a tension pneumothorax? Anybody know? Huh? Okay. All right. It's called a needle decompression. We take a 14-inch or 14-gauge needle, we stick it in their chest, and we release the air. All right. How do you think we treat a pericardial tamponade? Actually, not in our scope of practice. But what they do is called a pericardial centesis. All right, they take this needle, kind of like in Pulp Fiction, where he stabs the chick in the heart and she automatically, yeah, that don't happen. But however, doctors can take a needle, stick it in the heart, draw the fluid off. Usually done with ultrasound. And what about a pulmonary embolus? How do we treat that? Medication. Yep, medication. There are some, if they can locate where it is, they can go up in and grab it and pull it out. things like that. It's actually
That just sounds painful here.
pretty cool.
So, do you use like a dilator or a blood thinner?
You can use a blood thinner. It'll thin the blood. They have clot busters that they can give for that sometimes. But usually it's kind of just wait and see. A lot of times it'll move on and get carried out somewhere else. But most of these people will be on blood thinners. Okay. All right, obstructive shock results from a condition that obstructs forward blood flow. All right, metabolic or respiratory shock. Certain poisons, such as cyanide, interfere with the cell's ability to use oxygen. In this case, the blood is carrying an adequate amount of oxygen, but the cyanide prevents it from getting into the cell or the cell using it. All right. Also, carbon monoxide interferes with the ability of hemoglobin to carry oxygen. Carbon monoxide has a greater affinity to the hemoglobin on the red blood cell. All right, it will actually kick oxygen off the hemoglobin and bind to it. All right, and when you take a pulse ox from somebody, what are you looking at? Okay. Yes and no. Typically, it is the oxygen that's bound to the hemoglobin. But if you go pick somebody up that's been sitting in a car, encased or enclosed in a garage, if they've got something running from their tailpipe into their car, like they're trying to commit suicide, or a gas leak in the house, or house fires, you can put that pulse ox on and it will read 100%. All it's reading is that hemoglobin molecule is filled. It's not going to tell you the difference whether it's filled with oxygen or whether it's filled with carbon monoxide. Okay? Carbon monoxide has a greater affinity. But the telltale sign for carbon monoxide is they have a cherry looking color to their skin. Okay? They usually complain of headache. They can be kind of out of it, loopy a little bit. All right, the term hemorrhagic specifically indicates whole blood loss that can occur from a traumatic injury or medical illness. Medical causes of hemorrhagic shock include GI bleeding, uterine bleeding, aortic disease, ectopic pregnancy, and esophageal disease. Once whole blood is lost, there is not only a decrease in perfusion from a reduction in pressure, but also a decrease in the oxygen carrying capabilities of the blood from the loss of what? What carries the oxygen in the blood? Hemoglobin. So if I'm bleeding out from my ectopic pregnancy, that blood's not getting where it needs to be, right? Okay. So, how do we treat this? Easy. We stop the bleeding. Whether that be recognizing that it's an ectopic pregnancy or it's a aortic dissection, whatever's going on with them inside, we get them to the most appropriate care. All right, they need to be somewhere, excuse me, where they can get some immediate life-saving surgery. Okay, because we don't do surgery in the back of the truck. As cool as that would freaking be, I'd probably be the first one to do it. No, you'd be the first one.
Probably.
Yeah, I know. All right. Non-hemorrhagic hypovolemic shock is caused by the shift of fluid out of the intravascular space. All right. It goes into the lungs. It goes into the tissues. All right. Where it's supposed to be in the vessel, it is outside the vessel. It is somewhere it is not supposed to be. Okay? Burns. The skin plays a major role in regulating fluid retention in the body. Burns will disrupt the body's fluid balance. Okay? When the capillary is damaged from a burn, it becomes permeable. All right? It's leaky. Things can come in, things can get out. All right? The push from hydrostatic pressure forces fluid outside of the capillaries and into the interstitial space. Blah. The damaged capillaries allows plasma proteins to leak out and collect in the interstitial space. The pull effect of the plasma proteins that are outside the vessel draws that fluid out of the capillaries and into the interstitial space and does not allow it to return. Okay? Some of those plasma proteins you can think about would be like sodium. Waterfall is what? Waterfall is sodium. Right? Okay. Burn shock takes several hours to occur. All right. The key emergency care in the burn patient is to establish and maintain an adequate airway ventilation and oxygenation. Also, prevent further contamination of the burn injury. Do y'all know what most burn patients die from in the pre-hospital setting? That's usually in the hospital. I'm talking about the first 5 minutes. Airway. Airway management. Okay. A patient with burns is very hard to manage their airway, especially if they have inhalation injuries. Because if you see them on the outside, you get all that sloughing of the skin, it's red and it's bubbly and all that kind of stuff. Well, it's going to be the same on the inside in their trachea, their esophagus, their lungs. Okay?
Can you give positive pressure ventilation to the burn victim?
Yes, ma'am, you can. All right. Most burn patients die in the pre-hospital setting from airway obstruction, inadequate ventilation, or toxic exposure. All right. Anaphylactic shock is a type of distributive shock. The dilated vessels cause a reduction in the systemic vascular resistance. The vessels dilate. Okay. They don't have enough resistance to move that blood forward. Okay. Does that make sense to everybody? This is a vessel problem brought on by a reaction to something. All right. The loss of fluid from the capillaries prevents further. The loss of fluid from the capillaries further reduces the intravascular volume, causing the preload, stroke volume, cardiac output, systolic blood pressure, and perfusion to decrease. All right. How do we treat this? Epinephrine. Epinephrine contains alpha properties that causes systemic vasoconstriction. All right. Your alpha 1 drugs, you have one heart, 2 lungs. So alpha 1, beta 1 works on the what? Heart. Alpha 2, beta 2 works on the lungs. All right, the vasoconstriction reduces the vessel size and increases the resistance, which results in an increase in blood pressure and perfusion. All right, airway management, ventilation, and oxygenation are also key components of the emergency care for anaphylaxis. All right, this is the big one these days, okay, sepsis. We've learned a lot about sepsis in the last 5 years. Also referred to septic syndrome or septic shock. All right, it's the body's exaggerated inflammatory response to an infection, typically fungal, viral, or bacterial, that overwhelms the body's normal defense and regulatory system. All right, it causes a disruption in cell and organ function. The pathophysiology of sepsis is similar to the pathophysiology of anaphylaxis in that the underlying infection triggers a cascading release of inflammatory mediators. All right, pathophysiologies associated with sepsis includes increased capillary permeability. More stuff can get in, more stuff can get out. You have the vasodilation. Your vessels are bigger. Takes more to fill them up. You have myocardial depression. All right, the pump's not working as well as it should. Then you have damage to the alveolar capillary membrane, allowing fluid to accumulate in the alveoli, which makes it harder for what? What happens in the alveoli? Gas exchange. Okay? These other things, it's usually one thing you can fix. You can fix the vessel, you can fix the pump, you can fix the fluid. Alright? When it comes to sepsis, you kind of have to fix all three of them. Okay? That's why, like now, if you go into when you go into a ER, they will triage you. They will give you this sepsis screening, okay? Because we have learned if we don't catch this ahead of time and we wait until you are symptomatic and everything is going on, this whole cascade is going on, it's really, really hard to get you back from that, okay? It's too much damage. All right, some of the key physical findings of sepsis include tachycardia. What does that mean? Okay, tachypnea. What does that mean? Fast breathing. Hyper or hypothermia. Too hot or too cold. Okay, and hypotension. Huh? Low blood pressure. Okay. Some other signs are flushed, warm skin, mottled or cyanotic skin. That's a late sign, all right? It's a late sign because we already have things going on in the alveoli, all right? That gas exchange is already impaired. Can also have an altered mental status. This can be because of any of the things